called me a few months ago and you said, I like what you're saying about the treatment options, and surgery should be the first line of treatment for a lot of these prostate cancer because of the difference between before surgery and after surgery, the fact that these pathologies, random biopsies, are not accurate. What is the take on that? And
Right. Well, if you could imagine the prostate, walnut-sized organ, maybe slightly larger, and just randomly sticking some needles in there, you may miss a tiny focus of cancer, which is contributing to your elevated PSA and the whole reason you went into the biopsy. And we see oftentimes when prostate glands are removed, oftentimes the Gleason score of the final pathology is higher than that of that which was predicted on the biopsy. So,
meaning that the biopsies are not accurate, and the final report after surgery shows a lot more cancer and more aggressive type of cancer. That's what you're saying.
Absolutely. In a high percentage of cases, the biopsies can underestimate the true pathology.
Well said. I think the follow-up is also a big thing when it comes to surgery versus radiation, because I think after surgery, as you know, the PSA, for me, I like the fact that the PSA is always undetectable. And if the cancer comes back, you can always do radiation. But what do you see with radiation under your microscope and the specimen that comes from a surgeon versus after radiation?
Right. So radiation wreaks havoc on all tissues, whether they're malignant or benign. And under the microscope, when we're examining your specimen, it's sometimes very difficult as a pathologist to tell the difference between radiation-induced changes in normal tissue and that of tumor, and even whether the tumor was affected, not, whether it's alive or not, and it can really create a lot of confusion. The other difficulty with radiation is that I know you as a surgeon can have difficulty getting the gland out, which can disrupt the capsule and the borders, which are important.
You mean after radiation?
Yes, absolutely.
Surgery after radiation is very difficult. So just to summarize this, the advantage of surgery for prostate cancer is that you get the entire gland out. You know what the final pathology is, how much cancer there is, and what we call an accurate staging. Follow-up after surgery, the PSA should be 0 or undetectable. And if the cancer ever comes back in about 5 to 10% of the patients, you can give radiation after surgery, but the other way around, doing surgery after radiation is very difficult. We see so many ads, I'm sure it's the same in Boston, about cyber knife, and people think like an easy way out is the best way, but I think that's a big mistake. Any final word, Michael, before you head back to Boston? And I really appreciate you coming all the way from Boston to do the show.
Well, it's been a real pleasure to come down for the weekend and to attend the gala, the fundraiser for prostate cancer, Peter Latos, and for the opportunity to come on. I think I think for the listeners, there should be two takeaways. One is always remember the pathologist behind the scenes in order to really take full control of your health. And remember, June is Men's Health Awareness.
That's right.
Is to find out the answers. We're on AM 970, The Answer. I want you as a patient to find out the answer in your health care. And the number two one, and this strikes close to your heart as well, is PSA is one simple blood test.
Very good. Well said. And with Father's Day coming up, I think it's a big message to a lot of men out there to get tested. Know what your PSA is. Start at the age of baseline, at the age of 40. And talking to a lot of women out there, they have a big role. And not only you have to worry about your mammogram and pap smear and colonoscopy, now you have one more thing to worry about, which is your PSA for your husband and your boyfriend. So in that note, I thank you for being here, and it was a pleasure seeing you both and your wife, and look forward to in the future have more discussion. This music is for you, Michael.
Great, thank you.